नमस्ते। आज फेरि म लेप्रोसी प्रोग्राम को चाहिँ पार्ट 2 भिडियो लिएर यहाँहरु समक्ष उपस्थित भइसकेको छु। ट्रेन्ड इन डिसेबिलिटी चाइल्ड एन्ड फिमेल केसेस. Leprosy cases that are not detected early on may result in disabilities. Early detection, timely and complete treatment of leprosy are crucial factor for preventing disability. The proportion of grade 2 disability among new cases and the rate per 1 lakh population are major monitoring indicator of early case detection. During 2078-79, 2021-22, 107 cases of visible disability were recorded, with the proportion among the new cases of 7.44 nationally. Here you can see the diagram. Figure 5.1.5 trend in proportion of grade 2 disability child and female cases from 2067-68 to 2077-78. Source LCDMS, EDCD, DHS. A total 73 new child cases were diagnosed in 2078-79, resulting in 3.19 of new cases. This was a sharp decrease from the previous year, although the trend is fluctuating. Similarly, 989 female cases were detected in this fiscal, comprising 43.3% of new female cases. One of the target of National Leprosy Strategy 2021-25 is achieving zero grade 2 disability among new pediatric leprosy cases. In order to achieve this target, new grade 2 disability pediatric leprosy cases had been recorded for the last 5 years. In fiscal year 4, grade 2 disability new child leprosy cases were recorded. Release from treatment, complication and foreign cases. Release from treatment cases. Out of 4,629 cases taking MDT, 286 MB 1,551 and PB 535 cases completed MDT regimen and were released from treatment. The remaining 2,373 cases were undergoing treatment. Total transfer out cases were 24. Number of defaulter cases was 79 and other deduction were 67, excluding defaulter and transferred out, which include date, double registration, recycle and wrong diagnosis. Reaction and complication cases. During this year, a total 727 leprosy reaction cases, type 1:472 cases of type 2:225 cases were treated at different referral center is indicated in the table. The patient were provided with Nepali rupees 1,000 after the admission to hospital for treatment and management. Foreign cases. Every new foreign cases are treated in Nepal. Those foreign cases are assumed to be from India who seek treatment in Nepal due to open cross-border as well as stigma in their community. Some were migrant and daily wage workers. The cases are not counted in the new cases reported in our health information system. This year, 561 new foreign cases were diagnosed and treated from the referral center and leprosy hospital is follow. We can see total 561 cases from various hospitals of Nepal. Conclusion. The elimination status of leprosy as a public health problem was mentioned at the national level as the prevalence rate remained below the 1 case per 10,000 population this year. Although this rate was still above elimination threshold in 16 districts, the proportion of child cases has decreased due to the losing the lockdown imposed amidst COVID-19 pandemic in the fiscal year. The NCRD and PR has increased that of previous year as a result of increased field level activity. The figure for the main indicator of leprosy control for the last 11 years are summarized in table 5.1.5. Comparison of leprosy indicator from 2066-67 to 2078-79. Here you can see the various new cases, new case detection rate, under treatment cases at the end, prevalence rate per 1,000 population, and latest is 0.81. Proportion of child cases is 3.19. New grade 2 disabilities 170. Proportion grade 2 disability cases 5.81. New grade 2 disability child cases 4. Proportion grade 2 disability child cases 0.18. New female cases. Proportion female cases 43.3 released from treatment 2086 patient, no defaulter 79, number of relapse cases 28. Activities and achievement in 2078-79, endorsement of National Leprosy Strategy and Action Plan. Considering the previous National Leprosy Strategy 2016-20, finding and recommendation from the in-depth review of National Leprosy Program 2019, National Roadmap for Zero Leprosy Nepal 2021-2030, Global Leprosy Hansen Disease Strategy 2021-2030, as well as different health policy and plan of Nepal, National Leprosy Strategy and Action Plan 2021-25 with the goal of interruption of transmission of leprosy has been developed with the support from WHO, GP, JTL and other partner and endorsed by the MISP on 2079-24. It focuses on sustaining the gains made so far and concentrate on the remaining challenge for reducing the disease burden to achieve interruption of transmission, zero child leprosy cases for the consecutive 5-year leprosy in the endemic local level. Deployment of leprosy training package for health worker. Leprosy control and disability management section has developed the leprosy training module for basic health workers with the support of WHO. The training has been piloted and translated into Nepali. Leprosy service delivery. Fiscal year 2078-79, total 2,285 new leprosy cases were detected and put under the multi-drug therapy, and 2,373 cases were under the treatment at the end of fiscal year. During the year 2086, patients completed the MDT regimen and were released from treatment. Secondary and tertiary care services were provided to leprosy affected patients through the existing network of referral center with partner support. MDT drug provided by Novartis Foundation through the WHO and anti-reaction drug were freely available. The supply of drug to all province and local level were managed smoothly throughout the year. Case validation and data verification. Case validation and data verification were conducted in various high-burden districts that included Chittagong, Bardia, Beni, Jhapa, Rupande, etc. Conducted review meeting of leprosy control program for the fiscal year 2077-78 and first trimester of fiscal year 78-79. LCDMS has organized a review meeting on post 2078 to review the ongoing leprosy activities and identify the key action plan for the coming year. Conducted operational research. Operational research was conducted on epidemiology of leprosy control as leprosy cases identified through the active case detection at Lamki Suha Municipality, Kailali. Only 3 cases of leprosy were identified. Deployment of plan, policy and guideline. National Leprosy Strategy and Action Plan 2021-25 for 5 years 2021-25 has been developed in the fiscal year. IAC and advocacy. In order to enhance the community awareness, passive case detection, voluntary case reporting and to reduce the stigma, IAC activities were regularly undertaken using the electronic and print media. Poster highlighting the diagnosis, treatment and availability of free leprosy services were printed and distributed. Leprosy awareness raising messages were broadcasted through Nepal TV during the time of World Leprosy Day. World Leprosy Day. World Leprosy Day is celebrated on the last Sunday in the month of January worldwide. In Nepal, the 69th World Leprosy Day was commemorated on 16th March 2078, 13th January 2022 by conducting various activities at national, province and district level. A media interaction program was arranged at MISP in presence of the Director General of the Paris Division, WHO partner organization, media person, leprosy affected people organization to highlight the situation of leprosy cases in Nepal and issue and stigma related to the program. The day received enormous media coverage. Similarly, lightning at Darara regarding leprosy and anti-D message was displayed in the evening. Transport support to release from the treatment cases. The program provided grant of ₹1,000 to patient released from the treatment to cover their transport cost after completing MDT treatment. The treatment regularity rate of patient is increasing partially due to the provision of this incentive. In 2086 leprosy cases who had completed MDT were believed to be benefited by the transportation cash support budget allocated under the regular budget of local level. Recording, reporting, update, leprosy case validation, supervision and monitoring. Recording, reporting, update and case validation was carried out in various districts to verify data and record of cases in health facility, to validate cases diagnosed by health facility and to strengthen recording and reporting and the release of cases from treatment. Data verification was conducted in 15 high endemic districts. Coordination and partners. LCDMS organized coordination meeting among the partners that include WHO, Nepal Leprosy Mission Nepal, LMN, Nepal Leprosy Trust, Nepal NLT, International Leprosy Fellowship, International INF, NLR, Diamond Foundation, Fairmade Foundation, Partnership for New Life, PNL, Leprosy, Nepal Leprosy Fellowship, NLF, Nepal Leprosy Relief Association, NELRA, Seva Kendra, READ Nepal, and IDEA Nepal to share regular update on activities to have common approach to celebrate World Leprosy Day and to develop program guidelines. Similarly, coordination meeting with the partner working on disability management and rehabilitation sector were also held simultaneously. Grant to leprosy affected person. A grant was provided to support leprosy affected residents in the Kokna and Pokhara Arogya Ashram through the Nepal Leprosy Relief Association NELRA. The grant has been provided for leprosy affected people to provide fuel, blanket, food and incentive. Similarly, in the current year, a grant was provided to READ Nepal to support leprosy affected people taking shelter at its organization. Annual Report and Bulletin. Annual Report of Leprosy Control and Disability Management Program 2077-78 2020-21 was published, highlighting the activities conducted in the same fiscal year, including activity conducted by partner to support leprosy control program. Activities supported by partner. Fiscal year 2017-79, 2021-22, WHO Nepal supported technical support in developing the National Leprosy Strategy and Action Plan 2021-25. It also supports the supply of MDT drug, provide technical support for program planning and strengthening through the technical and financial support in active case detection, capacity building of health worker, routine surveillance, technical supervision and monitoring, and the community awareness program. The partner, the Leprosy Mission Nepal, Nepal Leprosy Trust, International Nepal Fellowship, Diamond Foundation, Netherlands Leprosy Relief, Fairmade Foundation supported the following activity in high endemic district. Community awareness and participation program, orientation of community member, provision of primary, secondary and tertiary care at referral centers, capacity building activity for government health workers, technical support through joint supervision and monitoring, prevention of disability in leprosy and rehabilitation center services, formation, implementation and support of self-care and self-help group operated by people affected by leprosy and people living with disability due to leprosy, support for post-exposure prophylaxis program. Similarly, regular coordination and cooperation are carried out with the partner and stakeholder working on the disability management and rehabilitation sector. Strength, weakness and challenges of leprosy control program. Strength: MDT free of cost transport service for release from treatment cases and other service for treating complication, accessibility to leprosy service to up to grassroots level, uninterrupted supply of MDT, good communication and collaboration among the supporting partner, improving participation of leprosy affected people in national program, steering coordination and technical committee formed and conducted meeting in regular basis, SCD contact examination surveillance of patient family member and neighbors, plan to implement leprosy post exposure prophylaxis in high endemic district. Limitation: poor institution setup and inadequate human resources, low priority for leprosy program at very few rehabilitation activities, inadequate training and orientation for newly recruited health worker and refresher training for focal person and manager, problem for reaction and complication management at very level, poor result based output recording and reporting of contact examination activities, under and over reporting of leprosy data in IHIMS. Challenges: no early case detection and management, high proportion of grade 2 disability, increasing new leprosy of cases, new cases of leprosy, ongoing high community transmission, high child case. Issue related to accuracy and under-reporting of leprosy cases in THIS system, low coverage of contact examination, and leprosy post ELPRP. Retaining trained human resources, cross-border information sharing, stigma and discrimination related to leprosy, maintain access and quality of services in low endemic mountain and hill district, poor motivation of health worker. Future course of action and opportunities: evidence-based planning based on the activity identified in National Leprosy Strategy and Action Plan 2021-25. Revision update of National Operational Guideline for Leprosy is for the new strategy. Develop SOP for the active case detection and data verification. Develop and piloting case-based surveillance system. Intensify IHC activity